Good evening, everyone. Good evening. My name is Patience Janama. Funds and clicks review coming your way. I'm just gonna come your way in like 20-minute video on safety and effective care management. That's the topic I'm gonna discuss. I'm going to be very quick. Safe and effective care management, and under that I'm tackling safety and infection control. So on the NCLEX, that is what is expected for you to know before you can pass the NCLEX. When you look at the test plan, we do have that on the test plan. So management of care and a safe and effective care environment. So we have the nurse-client relationship. What is nurse-client relationship? It is the fact that you and the patient that you are going to nurse should have a relationship. So before two people get to work together, they should have a relationship, and it should be a working, healthy relationship. So the nurse-client relationship is a professional relationship. So professionalism is specific knowledge. When they say you are a professional, that means you have a specific body of knowledge and skills. And this we can always find that in foundation of nursing science. So when you do foundations of nursing, they'll teach you about professionalism as a nurse. Person-centered. So a professional should be person-centered. So when you are answering questions under these ones, you should be professional before when you approach the patient. And then autonomy and accountability adheres to standards of practice and responsibility for care that is given. You have to stick to standards of care. So NCLEX has a standard that you are supposed to follow to pass. Standards of care for every facility also has their own autonomy, their own standards of care. So you have to be an accountable nurse. So when you are answering questions to the patient on the NCLEX, remember you are professional and you have the autonomy to make decisions and accountability. This doesn't have to do with legal nursing yet. Don't listen to that autonomy and think it's legal nursing. As a nurse, it is mounted on you to individually take decisions on what to do for the patient. That's why we have prioritization, because they want to test your ability to individually play an accountable role and be autonomous in your care. So the Nurse Practice Act, a professional is a person who also obeys the Nurse Practice Act. They give you standards of practice to follow. We have ethical standards under professionalism as well. Respect for human dignity. Give a respectful service, and regardless of the client personal characteristics, regardless of whoever the client is, regardless of the culture, regardless of where the patient is coming from, regardless of color, race, or creed, you are supposed to respect every patient, even if it is a child that you are caring for, even your own child. If your own child become your patient, you have to establish a professional relationship and you should be respectful. Confidentiality does not this one means you do not discuss conditions with anyone who is not involved in the patient care. So when NCLEX present to you questions about a patient that has been given to you on their care and whatever they should do, an option should never be the one that shares the medical information to someone who is not part of the care. So if you have a doctor that you are working with and another doctor come from the floor and come from somewhere else on the question to come and ask you of a patient medical record, or to ask you to view a patient medical record, you should not give it unless you have the permission that this doctor is involved in the person's care. Then you can give it. So regardless of whoever the person is, if we are all in the same working area and you are not the nurse assigned to this patient, unless you have a business or unless you are part of the care team that should be doing something for the patient, you have no business accessing the patient information. It's confidential and you don't have to share it. Advocacy. Advocacy protects clients from incompetent or unethical practice. So you, the nurse, has to be able to advocate for the patient. This is the role of a professional. So the topic I'm discussing is professionalism. So all these things are roles that a professional is expected to play, and that is you sitting here today. Competence. Competence means you have the necessary knowledge and the skill to provide the care in that particular area that you have been assigned. And then research, a professionalism, it accounts for research. You participate in the process of scientific inquiry. That's why you ask the patients further questions to understand what's going on. That's why when you hear of monoclonal antibodies, we hear of COVID, you are a professional who work in the area, you don't know what it is, you ask questions. That's part of professionalism. Promotion of public health, committed to local and global goals for health of the community, is also part of professionalism. Therapeutic nature of the nurse-patient relationship is what I'm going to discuss next. As a professional, you should be patient-centered. So answering NCLEX questions, make sure you are patient-centered. Don't go answering questions that favors the nurse and not the patient. The purpose of the NCLEX is how you take care of a patient. So every question presented to you is a patient that is being presented to you. So whatever you're going to do to take care of that patient, that's what you should be answering all your questions based on. Now, the next topic I'm going to discuss is, apart from patient-centered under professionalism. So apart from patient-centered under professionalism, we are going to talk about responsibility. You have to be responsible, you have to be goal-oriented, you have to be ethical in all your care activities. So you have to play all these roles. I'm sorry, give me a minute. Okay, so characterized by genuineness. It has to be a genuine care. And the nurse acts as a role model. You are a role model to every patient that comes to you. So the nurse is a role model to every patient that comes to you. The nurses copes with their own feelings. So it doesn't matter what went on in your house. When you go to sit on that NCLEX, it doesn't matter what's going on in your house. You have to be able to cope with the pressure of nursing. That's what NCLEX is testing you upon, testing you about. You have to be able to cope with the stress of the exam. You don't have to come and sit at the exam hall and all you are thinking about is how you had quarrel with your child or your husband or your boyfriend on the NCLEX. So you should be able to cope with the stress of life. Protected relationship. The nurse or the client, which is the patient, cannot be forced to reveal communication between them unless person who could benefit from the relationship agrees to reveal it. So whatever the patient tells you on the NCLEX, you are not supposed to reveal it unless the patient tells you of a suicidal ideation that you think this is a safety issue, then you can discuss it with the provider. But you don't even discuss that with someone who is not in the care team. So there are limitations to what you can discuss outside and what the patient can tell you. But if I am communicating with you, you have no business sharing that with anybody. So that have to do with protected relationship. I need to feel safe that if you know that I'm HIV positive, you are not going to discuss it to my boyfriend. You are not going to discuss it to my family member that I didn't opt for. I tell you, I don't want them to know what my diagnosis is. You have no business telling them, okay? Patient-client's bill of rights. So the patient or the client has a bill of rights, and that is privacy. So under NCLEX, note this: the patient has the right to be left alone without unwanted or uninvited publicity. They have the right. So the patient, you come to the patient, you come in to poke me with a needle, and I said, no, I don't want this. I have the right. You have to leave me alone. That's the right. The right to make personal choices without interference. Example is the contraceptions. I have the right to decide if I want IUD. So every patient have a right to accept every contraceptive method that they opt out for. Abortion, the right to refuse treatment. The only thing you can do as a professional is to explain to me the consequences of what my refusal of care will do. They have the right. That brings us to voluntary and involuntary patients. We have patients that voluntarily come to you for treatment. So if I voluntarily walk in, I have the right to voluntarily step out. So if I tell you at this point I'm done, I am no longer interested, don't give me anything, I want to go home, I sign against medical advice. The role of you, the nurse, is to give me education, teaching, which is a priority for nurses. NCLEX want to see your teaching ability. You have to teach me, and you have to document after everything. You have to let it be known that you had done this and that and that. I understand that this is my diagnosis, but I still opt to get out of the care team or to get out and go home. I chose it. So the patient have the right. Now, the right to have personal information kept confidential and distributed only to authorized persons. Insurance companies, they can have patient records because they provide payment. They are part of the care team. They are the medical record people. But if you are an employee there and you are not working on that particular patient chart, you have no business knowing what the patient was being charged for. So the rights and the confidentiality to keep their medical information private and personal is the patient's right. It's under patient rights of Bill of Rights. It's under Patient Bill of Rights. Authorized personnel, people involved in diagnosis and treatment related to the care of the patient. So they have the right to know the people who are doing all the care for them. So if I'm a patient, I have the right to know who is my nurse, who is my doctor, who is the assigned PCA for me today, who I can contact, who you are referring me to. I have the right to know. Don't just refer me to a physical therapist that I don't know to. Don't just refer me to a cardiologist that I don't know anything about. I have the right to know. Healthcare team can't use data, photographs, videotapes, research data without explicit permission of the patient. So you cannot come and take a video in my room and then you use it for research purposes. It needs permission. So if you are going to come and sit with me and talk to me and use that for research purposes, you need to seek my permission. If you want to take a video, if you want to take a recording of our conversation, you need permission to do it. So that is what is the right of the patient. And the healthcare team can't use, you need to be cautious about releasing information on the phone. That's difficult to identify caller accurately. So on the NCLEX, they tell you the family member called over the phone requesting for patient information, requesting to know what the diagnosis of their mother is. No, you don't have to give it over the phone. It has to be in person with proper identification. Request for their ID, you want to know their relationship, you can ask the patient, do you want me to discuss this with the patient? Unless they are in their, you have them as their care proxy, then it's fine. But if you don't have even their healthcare proxy, they identify themselves, they still need to come in person. You still need to see them one-on-one to discuss that. Discussing over the phone is no. Don't choose answers that describe scenarios that the patient information is being discussed over the phone. Necessary to obtain patient permission to release information to family members or close friends. They have the right to obtain that. You have to let them know, I'm telling your family your diagnosis is this, before you can tell them. For employees, they can only verify employment and comply with a legal investigation. So if you are an employee, you need to provide verification. You need to show your ID, that your ID has to reflect the current day. It's not the current day, it has to reflect your date of employment or the time of expiration. Then I know you are currently in this facility and this is the expiration date of your ID. You are an active member of the care facility. Then you can provide legal investigation. Respectful care is another patient bill of rights. Respectful care. So the first one I discussed was under privacy. So the patient will have the right of all these things I mentioned. Now, respectful care is another patient right. They have the right to be respected at all times, regardless of who they are. I mentioned that before. Current information, they have the right to informed consent. You just don't bring any paper and have them sign. They have the right to know what they are signing. So informed consent, they have the right. So these are the the relationship that should be seen in the nurse patient bill of rights. Now the requirement is the capacity. Capacity the age, competence, which can, like, whether the person has the necessary capacity or the person has the necessary required age to be able to make a choice and understand. So if I am 15 years old, I'm a minor, but if I am pregnant, I can decide that I don't want to keep the baby. That's an exceptional case. We'll get to it in the next video when we discuss those things. So the necessary age, an adult should be the competent one making decisions. Voluntary, freedom of choice without force, fraud, deceit, or any coercion. You shouldn't be pushed to make any decision. It should be voluntary. So information must be given in understandable form. Lay terminologies. Don't come to me with jargons. And clicks doesn't give you jargons. They only look for diagnosis that they know don't sound familiar to you. So if they don't sound familiar, that's what they dig into. They start mentioning those names. Instead of mentioning rheumatoid arthritis, they go mentioning a name that is equally rheumatoid arthritis, just to confuse you. So try to learn names that are unfamiliar with diagnosis attached to them. Then we have cannot sign informed consent if client has been drinking alcohol or has been pre-medicated. Informed consent may not be required in emergency situations. We have life-saving situations where you don't need informed consent for certain procedures. Mostly providers take consent. Nurses can be a witness for the consent. But if you have to take a consent and the patient's life is at jeopardy, the patient is about to die, and they have other laws that protect the care team to be able to take decisions. So when NCLEX start digging into these things, you need to know the legal aspect of nursing. I'm really going to go into those things. Minors who can provide own consent for treatment are married minors. So I'm 14 years, I'm married. I can provide my own consent. I break the law of being a minor at this point, even though I'm still a minor, but I will be able to make consent over a specific age 12, for STDs, HIV testing, AIDS treatment, drugs, and alcohol treatment. They can decide, I have been drinking alcohol, I want to be treated. They are minors, but they have the right to get all these things. They can sign consent for that. Emancipated and matured minors. So we have some minors that are basically matured. Like I said, it's not everybody that is minor that behaves like a minor. So sometimes be careful when you answer questions on the NCLEX. So they tell the child is 13 years, but the child has gone a step further in their thinking, and you realize that this child has a boyfriend, this child is outing, this child is well groomed, the child appears to be sound-minded, the child is pregnant, and they come over there. So we have the pregnant minors. So they can sign consent for themselves and their fetus. They decide for their babies. After delivery, the mother retains right to provide consent for their infants. And then most mothers cannot give their own consent unless she fits into one of other exemptions. So the mother retains the right to provide informed consent for their own child, but they cannot give their own consent unless she fits in one of other exemption. So if she's a drunkard and she starts drinking, she needs treatment for that, she can consent for that. But if she has to make decisions like to sign up for a doctor for her own self, her mother can decide for her. She's still a minor. That she lose that right. But if it comes to deciding for her baby, that she's 15 and she gave birth to that baby, she has the total right. No grandmother comes in. So in the NCLEX, note this kind of minors, this kind of people. So we have the capacity, the required, those that have the required age, and those that they can provide some information. We have the minors who can provide their own consent for treatment, and we have the pregnant minors. They are all in the category that they can provide own consent and requirement. Excludes these types of minors requirements exclude explanation of treatment and expected result, anticipated risk and discomforts, it includes. So you can be able to explain their treatment and what to expect as a result. You can help them anticipate the risk and the discomfort when you explain to them. This is teaching. This is the education part of nursing. So learn topics that talk about teaching. What will be the next step for the nurse to explain to the patient? What would be the best explanation the nurse will give to the patient? Those are teachings. What instruction will the nurse give? That's teaching. So they don't have to mention education on the NCLEX. They use other words that will imply that you are going to teach. So the role of the nurse in teaching is very crucial on the NCLEX. So you really need to become a teacher to pass NCLEX. Potential benefits. You explain to them the potential benefit of their consent or the treatment they are signing for, possible alternatives, answers to their questions. So these all fall under the fact that the person is a minor but can still give out consent. Statement that consent can be withdrawn at any time. So you need to let them know they can always withdraw that consent anytime they choose. I'm no longer interested. If you are no longer interested, come in, would withdraw everything for you, and you don't owe us, we don't owe you. Okay, so refusal of treatment, confidentiality, refusal, aggressive treatment, and advanced directives. I'm going to go into that in the next video. My video is supposed to be just 20 minutes. I'm going to come your way. We'll continue with confidentiality. We just finished with discussing with the minors and what they can do and what they cannot do. So we are talking about the patient bill of rights, patient or client's bill of rights, and clients will always call them patients. Sometimes they will refer to a patient as a client. So they have rights. That's what I'm talking about. I'm talking about safety and effective care management, or management of care, which has a bigger proportion on the NCLEX. So take note. I'm going to come your way to continue this video. I will be with you soon. Okay, thank you and bye-bye. Have a good day.